Hello everyone, my name is Janelle Bolanos and I will be presenting to you the topic of asthma, also known as bronchial asthma. So what is asthma? Asthma is a chronic lung disease in which your airways swell, narrow, and produce extra mucus. People with asthma have inflamed airways that react to certain inhaled substances. The picture on the slide demonstrates a normal airway compared to an airway during an asthma symptom. As you can see, the airway walls become inflamed and thickened. The muscles surrounding the airway tighten and constrict the airway. During this process, cells in the airway can also make more mucus than usual, which leads to a sticky airway. This combination of reactions is what leads to the reduction in airflow. Signs and symptoms of asthma can vary between people. It can be very frequent or only appear at certain times. They include shortness of breath, chest tightness or pain, which feels like something is squeezing or sitting on your chest, wheezing, which sounds like a whistle or a squeak when one breathes, and coughing. Not all of these symptoms occur with asthma, and these symptoms don't mean you have asthma. The best way to diagnose asthma is to use a lung function test. The causes of asthma are still unclear, but are most likely due to a combination of environmental and genetic factors. Some environmental factors are called asthma triggers. These are exposure to various irritants and substances that can trigger signs and symptoms of asthma. Some of these asthma triggers include airborne substances such as pollen, dust mites, mold spores, or pet dander, respiratory infections such as the common cold, physical activity, cold air pollutants and irritants, and strong emotions or stress can also induce an asthma attack. So who is at risk for asthma? Asthma is a disease that can affect all ages, but most often starts during childhood. Young children who wheeze and have respiratory infections are at highest risk of developing asthma that continues beyond 6 years of age. Some factors that can affect your risk for developing asthma include having allergies, having eczema, having parents with asthma, smoking or being exposed to secondhand smoke, being overweight, and being exposed to chemical irritants or industrial dusts. Asthma is a long-term disease that has no cure, but there are treatment options available. Some long-term control medicines reduce airway inflammation to help increase airflow, whereas quick relief treatments are prescribed to patients to relieve asthma symptoms that flare up, such as an inhaler. The biggest goal of treatment is to control the disease. These include figuring out and knowing your triggers to avoid them, keeping track of your level of asthma control, and working with your provider to create an asthma action plan to better understand how to treat your symptoms. If you would like to learn more about asthma, please visit the website of American Academy of Allergy, Asthma, and Immunology, as well as the National Heart, Lung, and Blood Institute, where you can find much more detailed information about asthma. Thank you so much for listening to this presentation, and I hope you've gained some new knowledge today. Have a great day.